Dear students, today we are going to see about the basic things about the enteric fever. So what are the objectives of today's class? So enumerate various causes of PO. PO means pyrexia of unknown origin. Basic microbiological aspects of Salmonella will be covered in the present lecture. Then pathogenesis and laboratory diagnosis of enteric fever. Treatment of diagnosed case of enteric fever. Then drug resistance. Few points about the drug resistance in Salmonella is also will be covered, and vaccination and immunoprophylaxis of enteric fever. Now this is the case. You can see here 38-year-old man presents with history of fever since last 5 days. On examination, the patient was febrile, coated tongue was revealed, and there was a relative bradycardia. And per abdominal examination revealed there is a hepatosplenomegaly. And in the blood culture, there was a growth of Salmonella typhi. So here you can see that is a characteristic feature of fever that is called as remittent fever or step ladder pyrexia or continuous fever, and there will be spikes of high fever, and it will never come to the baseline. So this is called as step ladder pyrexia. That is a characteristic feature of enteric fever. Now along with that there is hepatosplenomegaly. So this is the typical presentation of enteric fever. Now if you sell the fever, so there are various fevers encountered in medical field. For example, enteric fever that we are going to see today. Then typhus fever, which is caused by rickettsia. Then there is another fever which is known as rat bite fever, which is caused by Streptobacillus moniliformis and Spirillum minus. Q fever is another fever where Coxella burnetii is the causative agent. Then relapsing fever. Relapsing fever is caused by Borrelia recurrentis. So that is a relapsing fever. So different types of fever, the names is your undulant and Malta fever. The undulant fever or Malta fever is also another fever. So different types of fevers are encountered in medical field that they may ask in Viva. Now these are the various types of fever of unknown origin. Infectious causes may be there. Then neoplastic disorders, autoimmune disorders, and other causes. And if you go in the infectious causes, you can see bacterial infections, viral infections, and other. Bacterial infections, again, there may be organ specific infections. For example, infectious endocarditis, osteomyelitis, occult abscess, sinusitis, cholangitis, UTI, and meningitis. So these are the organ specific infections. Non-organ specific or generalized infections. Example is brucellosis, Q fever, Salmonella infection, that is enteric fever, Yersinia, tularemia, septic phlebitis, rheumatic fever, Lyme disease, tuberculosis, and Whipple's disease. So these are the non-organ specific bacterial infections. Now if you come to the viral infection, HIV, then Epstein-Barr virus, cytomegalovirus, then viral hepatitis, and enteroviruses. So these are the viral causes of pyrexia of unknown origin. Now come to the fungal pyrexia of unknown origin causes. Fungal infections, protozoal infections, malaria, and other filariasis also, other parasites, they can cause the pyrexia of unknown origin. Then come to the neoplastic disorders, non-Hodgkin's lymphoma, leukemia, solid tumors. Autoimmune disorders, SLE, rheumatoid arthritis, polyarthritis nodosum, giant cell arteritis, and sarcoidosis. Then others causes drug fever, infectious fever, trauma, non-infectious hepatitis. So those are the other causes of pyrexia of unknown origin. Now we are emphasizing in this class regarding the enteric fever, which is a multi-system illness caused by Salmonella typhi as well as Salmonella paratyphi. The infection caused by Salmonella typhi is called as typhoid fever. Infection caused by Salmonella paratyphi A and B, they are called as paratyphoid fever, and together they are known as enteric fever. So Salmonella was first discovered by Salmon and Smith in 1885, and the most important species was discovered by Eberth in 1880 and Gaffkey. So therefore the Salmonella typhi was called as Eberth-Gaffkey bacillus, and previously the name was Eberthella typhi. Now the genus Salmonella belongs to gram-negative bacilli, gram-negative bacilli which is in the Enterobacteriaceae family. So what are the characteristic features of Enterobacteriaceae family? So these are the gram-negative bacilli primarily residing in the intestine. As the name itself indicates, gram-negative bacilli, oxidase negative, catalase positive. Only one species which is catalase negative, Shigella dysentery type 1 is a catalase negative. Then glucose is fermented with acid and gas or only acid. They are motile or they may be non-motile. Nitrate reduction test is positive, and they are the show the fermentative utilization of the sugars. So these are all the characteristic features of Enterobacteriaceae family. Now come to the clinical classification of Salmonella. So there are two groups of Salmonella. One is the Salmonella causing enteric fever. They are called as typhoidal Salmonella, and there are other Salmonella species which are causing the non-typhoidal Salmonella, which is causing the foodborne gastroenteritis and septicemia. So those are the non-typhoidal Salmonella. The name itself indicates apart from Salmonella. Now come to antigenic classification. It is called as Kaufman-White scheme, and it is based on the somatic O antigen and flagellar H antigen. And based on O antigen, Salmonella are classified into 67 serogroups, and each containing group-specific O antigen. Now, for example, serogroup 2 contains group-specific O antigen type 2. Similarly, serogroup 4, it contains group-specific O antigen type 4. Group 9, which contains group-specific O antigen type 9. Now, this is the serogroup, and within each serogroup, depending upon the flagellar antigen, they are classified into different serogroups. They are based on the flagellar antigen. They are serotypes. Further are the serotypes, and 2,500 serotypes have been identified. So you can see here. So this is the structure of diagrammatic representation of Salmonella. Various antigen types are shown here. H antigen is here. Then cell wall antigen is there, which is O antigen, and outside the cell wall there is a capsular antigen which is called as VI antigen. Now, if you see the Kaufman-White scheme, based on O antigens, they are classified into serogroups 2, 4, 9, like that. And within each serogroup, based on H antigens, so that is the flagellar antigen. You can see here, based on flagellar antigen, each serogroup is further classified into 2,500 serotypes. So, the Kaufman-White scheme, based on O antigen, the serogroups, about 67 serogroups are there, and within each serogroup, based on flagellar antigens, we are having 2,500 serotypes. So this is the Kaufman-White classification of Salmonella. Now come to the molecular classification of Salmonella. It is based on the DNA hybridization studies. The genus Salmonella, it is classified into Salmonella enterica and Salmonella bongori. And Salmonella enterica, there are 6 subspecies: Salmonella enterica, Salmonella salami, Salmonella arizoni, Salmonella diarizoni, Salmonella horteni, and Salmonella indica. And each species serotypes are based on H and O antigens. Then Salmonella bongori is another group in the genus Salmonella, and most pathogenic, they are typhoidal and non-typhoidal Salmonella, and serotypes are placed in the Enterica subspecies Enterica. So this is the molecular classification. Molecular classification based on DNA hybridization studies. Antigenic structure, you can see O antigen is there. O antigen, that is the cell wall antigen here, and then H antigen, flagellar antigen, and just outside the cell wall you can see here, this is the capsular antigen. This is called as VI antigen or surface envelope antigen. So surface envelope antigen is there. So what is the applied importance of this? So H and O antigens, H and O antigens are used for the Vidal tests. These are the antigens we are testing. Then what is the importance of VI antigen? The persistence of VI antigen indicates carrier state. VI antigen, the antibodies produced against VI antigen are protective. Therefore, VI antigen is also VI polysaccharide. The chemical nature is polysaccharide. VI polysaccharide antigen is also used for vaccination. Although the titers produced antibodies of titers produced is less, but the antibodies are protective. Therefore, it is also used for vaccination. Now come to the pathogenesis of enteric fever. The route of entry of bacilli, that is by contaminated food and water. The infective dose, minimum number of organisms required to cause the infection, it is higher than Shigella, because Salmonella is having higher infective dose, 10^3 to 10^6 bacilli, because Salmonella are susceptible to the gastric acidity, whereas Shigella, comparatively or relatively, Shigella are resistant to the inactivation by the gastric acidity. However, there are patients with risk factors suffering from achlorohydria or taking antacids, or if there is a loss of intestinal integrity. Those are the risk factors which will increase the chances of infection. The entry of organism occurs through the epithelial M cells. So there are the specialized M cells. So you can see here M cell. So bacteria mediated endocytosis will occur. So these are the M cells which are specialized cells on the intestinal epithelium, where the first approach of bacteria, encounter of bacteria with the intestinal epithelium occurs, and there is a bacteria mediated endocytosis on the intestinal epithelium. Then Salmonella containing vacuoles reach the submucosa and endocytose by macrophages. So you can see here macrophage which is there, which will engulf Salmonella. However, Salmonella survives inside the macrophages. So macrophages carry them to the lymph nodes, mesenteric group of lymph nodes, and afterwards there is a primary bacteremia. After primary bacteremia, they spread to liver, spleen, lymph nodes, bone marrow, and multiplication of Salmonella will occur in those places. Then there is secondary bacteremia, and they get seeded, the Salmonella gets seeded into the various other organs. So this is the example of intracellular bacteria. So give the examples of bacteria which are present intracellularly. So what are the examples of bacteria which are present intracellularly? The example is Mycobacterium leprae, Brucella, Rickettsia. So these are the intracellular organisms, and the mechanism of immune response for intracellular microorganisms is by cell-mediated immune responses. The humoral immune responses are not effective. Now come to the clinical features. So in the beginning, we have seen the case. So step ladder pyrexia, that is the characteristic feature of enteric fever. Then generalized symptoms such as headache, chills, sometimes cough may be there, sweating, myalgia, arthralgia are there. Then skin rashes, they are called as rose spots. A little examination of patient's body surfaces will be helpful to delineate what is the cause. So that is helpful. Then intestinal manifestations are also there: abdominal pain, nausea, vomiting, constipation, diarrhea. So these are the other features pertaining to intestine. Then further chronicity leads to hepatosplenomegaly, epistaxis, and relative bradycardia. So in the case which is given in the beginning, so there was a relative bradycardia. Then complications: gastrointestinal bleeding, intestinal perforation, those are the complications. Then neurologic manifestations also include meningitis and cerebellar ataxia. So these are the overall features, but sometimes the atypical presentations have been demonstrated and various case reports have been given. Multiple abscesses formed in the organs have been presented as a atypical presentation. Now come to the epidemiological aspects. The human beings are the only natural host, so there is no any extra human reservoir. The source of infection, that is contaminated water and food. And if you see the prevalence as per the WHO estimates, 11 to 21 million cases of typhoid fever occurring annually, and in India itself only about 6 million cases have been reported annually, and it is an urban disease rather than rural disease, and most common among children and adolescents as compared to adults. And Salmonella typhi is the most common species than Salmonella paratyphi. Also, carriage is more common. Carriage, for example, fecal carriage, urinary carriage, that has been found. So, food handlers act as a source of infection, and all of you know that there was a person known as Typhoid Mary who lived in New York, and she was responsible for 1300 cases in her lifetime. So that is the example of how the food handlers are responsible for initiating the outbreak of uh, this enteric fever. So screening of food handlers for enteropathogens is very important aspects, and we should do in the healthcare settings to prevent hospital acquired infections. Now come to the laboratory diagnosis. The specimen collection depends upon the duration of illness. In the first week, the samples collected will be blood culture, bone marrow, then duodenal aspirates. So blood culture is the most favored option for the sampling, whereas bone marrow and duodenal aspirates, these are the invasive techniques which again we have to take the patient consent and do. So patient compliance will be less. Then in second week of illness, we have to go for the serum sample for demonstration of the antibodies, and the test performed is Widal test. Then third week of illness, we have to go for urine or stool culture. We have to go for urine or stool culture. So blood culture is the first sample which is to be done with the acute phase of illness. The culture positivity will be 90% positivity in the first week of illness, and gradually it will fall down. In the second week, it will go up to 75%, and third week 60%, and afterwards 25%. So it is better as early as possible. We have to go for the sampling for appropriate diagnosis of enteric fever. 8 to 10 ml of blood is collected aseptically without any contamination of the microorganisms on skin, without contamination of skin flora, and they are added in the enrichment medium like BHI broth or bile broth. So bile broth or BHI broth, it is the enrichment medium for blood culture. Or nowadays automated blood culture methods are available. Automated blood culture, commercially available blood culture bottles are used, and they are inoculated without any contamination by aseptic measures. Then the conventional blood culture bottles are incubated at 37 degrees Celsius temperature, and they are subcultured on every alternate days till the appearance of the colonies, growth of the organism, incubated for 1 week. Then in biphasic medium, the colonies are examined daily on the slope. So what are the advantages of biphasic medium? So there is no need of opening the bottle and subculture. So there is chances of contamination of the bottle will be decreased. Chances of laboratory worker infection is also reduced. The wastage of media is also reduced. So these are the advantages of biphasic medium. Then automated blood culture system, nowadays it has become popular. Just you have to load the automated culture bottles in the machine, and it shows flagging where it will show the slot where the bottle is shown the growth. And then further we have to subculture and go for further identification. Then after subculture, we have to do the reading of the colonies. Now these are the various photographs shown here. The blood collection procedure. So this is the vacuum which will automatically collect the blood sample. So this is the BHI broth, brain heart infusion broth. We can use bile broth also. So please remember, bile broth is used as an enrichment medium for blood culture, and there are also other enrichment medium for other samples. I will tell you in the next slide. Then you can see here biphasic medium. The advantage of biphasic medium is that liquid medium and solid medium are there. So there is no need of opening the bottle. Once you inoculate the bottle, completely sealed, the contamination is reduced, infection to laboratory worker is reduced, wastage of media is reduced. If you use this by BHI broth or bile broth, every alternate days we have to take little bit of the specimen, aspirate with the needle and syringe, and subculture. So repeated handling of the sample in this BHI broth or bile broth will cause the contamination. Again, it will be futile if there is a contamination. So this is a media for automated blood culture. So these are the commercially available media, ready-made media. We have to just inoculate it and incubate in the slot of automated blood culture system, which will provide the appropriate temperature and uh, for the other requirements of the culture. Now come to the stool and urine culture. Third and fourth week of illness, we are going for stool and urine culture. The urine is centrifuged and the deposits are inoculated onto the McConkey's agar. And for stool culture, we are using salinity of broth or tetracyanate broth as an enrichment medium. So please remember, for stool culture, we are using salinity of broth or tetracyanate broth as an enrichment medium. And for blood culture, we are using bile broth or BHI broth as an enrichment medium. Then What is the selective medium used? Selective medium, we are using selective medium XLD, xylose lysine deoxycholate agar, or we can use the uh, Wilson Blair bismuth sulfate medium for stool samples. So other specimens, as already I told you, bone marrow 55 to 90% sensitive, but it is again invasive. So we have to convince the patient and collect the sample. We have to take patient consent. Then duodenal aspirate again it is invasive. We have to do the procedure on the patient. Then we can go for combination of these methods for appropriate diagnosis of the disease. So these are all the first week of illness. Now, once the growth occurs and after subculture, we have to go for further identification and antimicrobial susceptibility testing. So you can see McConkey's agar here, non-lactose fermenting colonies, translucent, pale, non-lactose fermenting colonies are there. And XLD agar, pink colored colonies with black center are seen. Then DCA, deoxycholate citrate agar, pale colonies with black center. Why there is a black center formation? Because Salmonella typhi and paratyphi B produces H2S, and because of that there is a formation of black colored colonies on those media. Then further we have to do the smear from culture, go for motility testing, then biochemical identification. We have to go for slide agglutination test for typing, and then antimicrobial susceptibility testing should be done on molar Hinton agar plate. And automated method, we can go for MIC detection by Vitek method. Once the growth is obtained, we have to go for the biochemical reactions, the sugar fermentation, glucose, mannitol, maltose. They are fermented with acid as well as gas, but exception is Salmonella typhi, which is anaerogenic, which produces only acid and no gas. Lactose, sucrose, and salicin are not fermented. Indol is not produced. MR is positive, VP is negative, and citrate is positive. Urea is not hydrolyzed, and H2S is produced except Salmonella paratyphi A and Salmonella cholerae. So if you see only Salmonella typhi and paratyphi, Salmonella typhi and Salmonella paratyphi B produces H2S, and Salmonella paratyphi A doesn't produce H2S. So Salmonella paratyphi, it produces just a speck of H2S, whereas Salmonella paratyphi B produces abundant H2S. So these characteristic features are helpful for differentiation within the species. Now again further intra-species differentiation. The sugars which are used for differentiation are glucose, xylose, D-tartarate, and mucate. So you can see here, I told you glucose, Salmonella typhi produces only acid. Salmonella paratyphi A, B, and C, they produce acid as well as gas. Then xylose, paratyphi B and C produces acid as well as gas, whereas Salmonella typhi, it produces the differential reactions. Then D-tartarate, Salmonella typhi produces acid in D-tartarate, and then Salmonella paratyphi C produces acid as well as gas. Then mucate, Salmonella typhi gives differential reactions. We can't conclusively find out. Whereas paratyphi B, it produces acid as well as gas. So this table helpful for PG students for culture seminar for identification of the Salmonella species. So if you put the glucose, it will be helpful. Glucose, xylose, D-tartarate, and mucate for further identification up to species level. Now come to the next, that is the serological method for diagnosis of enteric fever. Vidal test. In Vidal test, we are detecting the antibodies produced, and Vidal test is used for the second week onwards because the antibodies are not produced in the first week. Here the serial dilutions of the patient's serum is uh, taken, and we have to add the antigen. The four types of antigens are used: TO, that is salmonella typhi O antigen; TH, salmonella typhi H antigen, flagellar antigen; then AH, salmonella paratyphi A, flagellar antigen; and BH, salmonella paratyphi B, flagellar antigen. These are four rows should be arranged, and we have to take make the doubling dilutions like 1 in 20, 1 in 40, 1 in 80, 1 in 160, 1 in 320, 1 in 640, like that. Then add the stained salmonella antigen and incubate at 37 degrees Celsius temperature for overnight period, and see the maximum dilution which gives observable reaction. Maximum dilution which gives observable reaction, which gives the titer of the Vidal test. Vidal test is also modified in the form of slide Vidal, which is shown in the photograph here, where concentrated antigen is used for detection of the antibodies. Then other tests are also there, where rapid antibody detection tests, we can go for immunochromatographic tests like Typhi dot rapid detection test. Then antigen detection by ELISA we can go. Then molecular tests like PCR, where genes which are used, that is flagellin gene, IROB gene, and FLIC-C gene. These are the used for PCR genes used for diagnosis of enteric fever. Then non-specific findings are also to some extent will be helpful, such as neutropenia. Then come to the detection of carrier. So we have to go for culture, stool culture or bile culture. It is used, and it carriers also detection of VI antibodies. Persistence of VI antibodies indicates carrier state. So VI antibody detection is helpful for detection of the carriers. Isolation of salmonella from sewer swab method, and then we have to collect the sewer swab and go for filtration and isolate the organism to trace the source of carrier in the community. So it is a community based approach. Now come to the treatment aspects. Ceftriaxone, that is a drug of choice. Then alternative drug, that is azithromycin. Then fluoroquinolones. But here fluoroquinolones, the antibiotic susceptibility should be available. We should not blindly go for the fluoroquinolone treatment. So after doing the antibiotics, empirically it is not advised. We have to go for antibiotic this treatment with fluoroquinolones only when the antibiotic susceptibility report is available. The carriers are treated with ampicillin or amoxicillin plus probenecid for about the 6 weeks. Now, the antimicrobial susceptibility testing for salmonella is also very helpful, and it is important because it has developed the multiple drug resistance. So MDR, multiple drug resistant salmonella typhi, it is termed for the strain of the salmonella which is resistant to chloramphenicol, cotrimazole, ampicillin, and then fluoroquinolone resistance is also there. So ciprofloxacin resistance is also there. Therefore, always we should keep in mind that the fluoroquinolone drug treatment should be given only after the antibiotic susceptibility report is available. Then resistance to ceftriaxone also have been demonstrated. It is very rare, but it has been reported recently. Now the preventive aspects, prophylaxis, it includes control of cases, control of carriers, sanitation measures, and vaccination. So now you come to the vaccination. So what are the types of vaccine? VI antigen capsular polysaccharide vaccine, VICPS, which is been permitted by WHO, capsular polysaccharide vaccine. Then same capsular polysaccharide vaccine can be conjugated, that is called as VIR-EPA. VIR-EPA conjugate vaccine, that is VI polysaccharide, which is conjugated with exoprotein A from Pseudomonas, which this exoprotein A potentiates the immunogenicity of VI polysaccharide, acts as adjuvant in other words. So it is also been introduced, but it's not been rolled out for the use. Then Typhoral, which uses the Gali mutant, is also there. Oral, it is taken oral, so patient compliance will be better. Then the old vaccine, that parental vaccine, TAB vaccine, is no longer used because it has been proved that it's not that much immunogenic. Now the take-home message: this enteric fever is a major communicable disease. Appropriate diagnosis, clinical as well as laboratory diagnosis, is very important to delineate what is the cause of the fever, virus of unknown origin, and appropriate treatment is necessary because this organism shows drug resistance. Then the spread of infection in the community should be minimized by screening the high-risk individuals, food handlers to minimize the source of infection in the community, and environmental sanitation is also very important for control of this disease. Thank you for your patient listening. Thank you.